I kind of first wanted to become a doctor very young. My dad's a physician in Arkansas. He's retired now, but just growing up, I always went to the hospital with him. Got to hang out in the doctor's lounge. He'd always bring home, surgical hats or masks, and so I kind of always played with surgical toys, I guess. And so I was always real proud of him. And then growing up, I even started out as a volunteer at the hospital and was transporting patients. And I did like a mini med school in junior high and in high school. And then in high school, my summer jobs were working at the hospital as a orderly, and then I worked my way up to being a surgical scrub for specific surgeons in the hospital. Lots of things. One, truly helping people. So if someone's sick, I kind of do a lot of things, but if I see someone sick or something like that, just knowing that I help them get better, I'm really passionate about that. But then in this field, in cosmetics, just helping someone achieve what their goal is, improve their self-image by just making a little change in their life, and just seeing how happy they are with it, that's satisfying to me. And then kind of in another realm, I do the weight loss surgeries, and so in helping someone that was had really low self-esteem but also truly unhealthy, and maybe they were morbidly obese and weighed 300 pounds, and I help them weigh 140 pounds now. And they just said how much I've changed their life and how happy they are. That's really satisfying. My personality, for one, I think if you ask any of my patients, they'll say that I'm different than most doctors. I'm friends with most of my patients. I hand out my phone number, personal cell phone number, to most of my patients just because I like having that relationship with them and letting them know that if they need to get in touch with me for any reason that they could. But I think that just kind of gives a mutual trust to the patient and me, and also helps develop a friendship, and kind of goes beyond the normal doctor relationship. And I think that's kind of one of the main differences.